it. Thank you. I have one of those questions I can ask, and I can ask. One of the questions determine whether there's anything else you know what, American TV,
come through this section here, and this is the check-in. And normally, we have it scheduled such that people won't really need to line up, but this is contingency planning for people. So what if we have people that can create a lineup? And as you'll see, there's a stop here. We'll have another monitor here to help then people go from the screening and this process. And here, they have an opportunity to it will be flagged by a live monitor here, and you'll see people are holding different questions.
Indicate which?
Whether we're ready for the next
Oh, I see. Oh, yes. Okay.
And so we're going to head over to number 2. So you'll see we have check-in groups all the way through.
How you doing, guys?
Morning.
Good morning. And over here, if I can get you one at a time, I'll step over here. Mr. Mayor, you can...
I can stand on the outside and one can
Sure.
stand on the inside.
Mr. Premier, please.
How are you?
Hello,
Good. How are you doing today? Thank you so much.
I'm fine, and you know, if there's something, can I have your QR code so I can check in the system?
My postal code?
QR code, you register for the...
No, I don't have the QR code.
Not yet.
Okay, not yet.
That's the first thing you'd ask
Have
for.
your last name, please?
Okay.
Mr. Premier?
Yes.
Sorry, sir, if I could get you just to stand over on this side, that would be helpful.
100%.
And your last name?
Okay, there we go.
Yes, there you go. I can see you have an appointment at 11 o'clock. Thank you very much. You're now in the system. You can follow the line.
My name is John Tory, T-O-R-Y.
And that piece of paper there, the piece of blue piece of paper, is that something you have to fill out, or how does that?
That's very efficient.
If someone chooses not to have
Yeah, so you'll see that courtesy of the folks that we talk about, they're talking about our process, so the technology is built in, and we've got new systems from registration and scheduling of appointments to begin with, right through the check-in, and then ultimately to the administration.
And is the iPad, that's part of the clinic in the
That
box?
is part of the clinic in the box.
They're supplying to, this is, I think it's the point of all the mayors, there's some of them are so this whole thing is being sort of, you get the clinic in the box protected, so you get the whole registration protected, and give you a label, but they're very interested in getting it, like they really, they want this.
I would just say to Chief Pegg, Premier and Mayor, that that might be the most important thing of all that we're going to have to do a mass vaccination clinic outside of hospital setting with a clinic in a box and see what it is we can do. That we want to run out 50 of us.
So yeah, let me explain to you the aperture, and then I'll let you go to it. So this is the aperture. You see that you are required to stay. It may not have anything to do with the aperture. Sometimes it's just the experience of having done it.
It's the same flu shot.
It is exactly the same for the flu shot. Again, it's a safety issue. We ask you to stay for 15 minutes, reassure you, and then you'll see the checkup process. But I'll show you that. Why don't I bring you over to the
Excellent. Well, first of all, good morning, everyone. And it's a real privilege to be here with Mayor Tory, Dr. Davila, Chief Pegg, and General Hillier. this is going to be one of the mass vaccination centers. They'll be able to put approximately at the beginning about 250 people through here, and I'm sure they can max that up to a higher amount. But I just want to thank them all for their incredible work. You can see how organized it is, and great structure, and folks, we're going to get people vaccinated as soon as possible. And I just want to thank everyone for following the guidelines, and as we say, stay home, stay safe, and save lives. So this is going to be great. It's going to be a pilot project that we can expand right across the province. I know General Hillier is looking at 50 different sites across the province. And again, I just want to thank people once again for following the guidelines from the Chief Medical Officer and the Public Health Officer. They've all been doing an incredible job, and the people of Ontario have been doing an incredible job, and we will get through this. And I always say there's sunrise on the other side of the horizon, and we'll come out of this as strong as ever. I'll pass it over to Mayor Tory.
Well, thank you, Premier. And I see today as being something that hopefully should give people hope for a number of reasons. First and foremost, there is the hope that the vaccines are on their way. And I think you can see when a facility like this is opened, it truly gives us hope that the arrangements are being made, the details are being worked out, and it will be done through a proof of concept, as we would say, to make sure that this kind of setup, with all that's involved, if you think about it, it's quite complicated with the registration of people and making sure you have the right people to actually give the injections, and who the order that's determined by the province as to who gets to come here at a given point in time. The second reason for hope beyond the vaccine itself is that we are actually doing something here that will be of benefit province-wide. The lessons that are learned here about how you can move people through and how you can make sure they're given their injections safely and efficiently, and all the systems that have to go with that, because if you think about it, it is complicated. Those lessons will be shared across the province. And I was telling some of my fellow mayors this week in a meeting we had that there will be a playbook that will be issued out of this, if you can call it that, that will tell everybody how to make sure, based on the lessons learned right here, that you can do this effectively. And I guess the third reason for hope is that the governments are working well together. And I just want you to know, from the standpoint of the City of Toronto, we are working well with Premier Ford and his ministers, but also with people like General Hillier. We have our own wonderful team, Dr. Davila, our Medical Officer of Health, Chief Pegg, who's looking after all of this and our vaccination rollout pursuant to the arrangements that are put in place by the province. We're doing a lot of things at their request to try and be helpful, because in the end, it comes down to what the Premier said. If people can stay home, and not associate with others outside of their own home, if they can limit themselves to the things that we've talked about as to why they leave home, and if we can continue as governments to work together to get these kinds of things done, then the combination of people and their own sense of personal responsibility and their own, I'm sure, intense desire to have this all over with, combined with the actions that are being undertaken by this great team of people, including all the public servants in all the governments, and that's all also dependent upon the supply of the vaccine. But if that all happens, then I think spring will be a much brighter time for us all, and we will get through what I know is a difficult winter so far for people. So I just want to say thank you again to the people that have really carried the laboring oar on this, all the staff people provincially and locally, the people who are setting all of this up and showing leadership, General Hillier, Dr. Davila, Chief Pegg, and to say that the Premier and I will continue to work together to make sure that we protect people in the short term, but that we also make sure that things like this, which will provide long-term protection, are getting done effectively as well. So thank you.
Thanks, everyone.